I want to confirm that there was a message from Ministry of Health. That was how it read. And they were sending information to coronavirus toll-free line. There's a 0800721316. Is that your number? That's the number. So I just wanted to just do a test and call it now so that we can know whether it's working or not working. So it's here. So don't say it doesn't work. So it's ringing so that we hear the response. We are here, all of us.
The person you called is not reachable. We will notify you when the mobile subscriber is back.
Indeed.
So now, if I have coronavirus...
Try the other one.
Okay, that's the first one. So that one, the one I called was 0800721316. So that's the response. The other one is... That is a toll-free one. So that's the one that all Kenyans received. So the other one is 07?
0732.
32, yes.
353.
353.
535.
535. But that is not toll free, yeah?
This is not toll free.
So it's okay. That's the second one. It's not. I think we are the people's representative, isn't it? So this is the number we are giving.
Are they too busy or people?
Yeah.
And we don't have a coronavirus case yet. Hello, how are you?
I'm good.
I wanted to report a case of coronavirus.
This is when I for reporting about issues concerning coronavirus.
Who am I speaking to?
I'm Jackson January.
Okay. Now, what am I supposed to do?
Regarding what?
Coronavirus. I feel like I have the symptoms.
You see?
Like I have the symptoms.
That you're having symptoms?
Yes.
Now, we don't have any coronavirus in the country unless you tell us how you could have contracted it. Hello?
I had traveled and I'm getting a bit of some fever.
No. Which country have you traveled?
China.
China?
Yes.
Now, all right, what time was that? And which part of China were you?
I was in Guangzhou.
Huh? Guangzhou?
Yes, and I'm feeling sick.
You're feeling sick?
Very sick.
Very sick. But the way I hear you don't sound to be very sick. You sound to be very sick. Very hard laugh.
So what can I do?
Yeah?
I am in Murang'a. What can I do?
You're in Murang'a?
Yes.
Were you screened through the airport?
Yes, and they told me to go home, and they told me I self-quarantine.
Did they tell you in case you start getting symptoms what you should do?
No, they didn't. That's why I've called this number.
Yes.
Because I saw it's a number for Ministry of Health.
Sure.
Yes.
Now what you need to do is, which hospital is nearer to your place?
Murang'a General Hospital.
Okay, just go there
Uh-huh.
and tell them how you are feeling.
Uh-huh.
You take the history.
Uh-huh.
Because it is not necessary that you have the coronavirus. Because around this time, we are getting report of the flu.
Okay.
People, they have a lot of flu currently.
Okay.
So they will take your history.
Uh-huh.
And in case they suspect it could not be the normal one,
Uh-huh.
they just call us immediately and then we'll be able to advise them what should happen.
Okay. Okay, thank you. Now, do I use Matatu or Boda Boda or what do you advise?
All right, all right. Well, how far are you from Murang'a General Hospital?
I'm in a place called Kamahoha.
Kamahua,
Yes.
are you able to get a private means?
No,
Yeah, why?
I don't have money.
You don't have money, and you had gone to China to get.
Anyway, thank you.
You went to China, you don't have money.
So seriously, one, I think you have employed cartoons. But number two, so that is generally, we were testing. So the first one, the toll-free line is not working.
The toll-free line is actually a test line at the moment, but
Okay.
it will be activated, and it will not be just with that one. That's an Safaricom line. You get an Airtel line and a Telecom line as well.
Okay.